first thing we'd like to talk about is the president. The president took wide-ranging action over this last weekend to do with immigration and refugees. Do you support the president's actions? And if so, could you kind of take us through your thought process on that?
Well, the president has the right to move forward to make sure he's protecting the American people. I think the president does not have his full cabinet. The president is working out the changes without having the cabinet there, and he's worked the difficulties out from the rollout, and I think you see that it's moving forward fine now.
Okay, there was a longtime resident of Bakersfield, a woman who's a green card holder. She's a physician here. She was returning from a trip to the Middle East and was detained for quite a while at LAX immediately following the rollout of those actions. Can you say anything to her or to others that are going to be in her position to alleviate any concerns that they may have about whether our country trusts them, likes them, etc.?
We're a nation of immigrants. My family come from Ireland and Italy. We're living in a trying time today. We want to make sure that this is a pause in the system to make sure that you're screening individuals who are coming from Syria and coming from Iran, a couple nations that are in war right now, that the people that are coming over, that are making sure the screening system is correct of who's coming into the country. It's only for 90 days and 120, making sure there's a pause in the system to make sure it's done right. The president is just now coming into office. He does not have his cabinet there. I think there was a little disruption when it first came out, but they've been able, now that you have a Homeland Security, General Kelly, they've been able to work through those difficulties, and I don't think they'll find those problems again.
So just because there's been so much confusion, just moving forward, do you think there's any reason for legal green card holders from anywhere in the world that are living here, do they have any concerns about their future being able to live here and come and go as they please?
I'm sorry, can you say the question again?
Yeah, sure. Just because there has been some confusion with the rollout, is there any reason moving forward for legal green card holders from anywhere in the world to be concerned about their future living in America or coming and going America?
No, I think that's been clarified. General Kelly clarified that, and there's no concern for that.
Okay. Next thing we'd like to talk about is health care. The President and the Congress have been moving forward with their plan to repeal Obamacare. There have been a couple of pretty large demonstrations at your district office here in Bakersfield over the last couple of weeks. People afraid of what is going to happen next. Republicans have been talking about repealing and replacing. There's really not been a whole lot of talk about what the replacement is. Can you shed any light on that for our viewers?
Well, you first have to talk about why there needs to be a repeal of Obamacare. When Obamacare was first being talked about going into effect, it was talked about if you had your doctor, you could keep it. We found out that wasn't true. That your premiums would go down. That was not true. We now have found that it created 23 co-ops and provided $2 billion. 18 of those co-ops have collapsed. There's roughly 3,000 counties in America. 1/3 of those, 1,022 of those counties, only have one insurance company. 5 states only have one insurance company, one provider. It's continuing to collapse upon itself. So you cannot sit back and have the healthcare system in America to collapse on itself. You've got to repeal it, and you've got to replace it with a system that actually works. So we've talked about this throughout the campaign, and we're going through the system right now. Right after the election, I put a letter out to every Democrat and Republican governor, insurance commissioner, to provide us with your ideas as well. We want everybody to participate in this. We want individuals to be able to go into the marketplace, to have greater choice, to be able to choose, be able to have a relationship with their doctor, not to have Washington to be picking and choosing what type of healthcare system you could have. People to be able to pick across state lines, just like you do when it comes to your car insurance, to lower the premiums when it comes forward. I think that will be a much better system. As we move forward, people will be able to participate in the debate and see that a system that will actually work and sustain as we move forward.
Okay, but I still didn't hear anywhere in there any solid plans about a replacement. I heard being able to buy insurance across state lines. What other specifics can you give
Well,
us
let me
about the plan?
let me walk you through it then.
Okay.
Because what we're talking about right now, and what you have to do is, it's going to go through committee. So we're not going to push this upon somebody. Everybody's going to have a choice to be able to talking about it. So first of all, you have a system. If you're already on Medicare, Medicare's there. If you already have a healthcare system that's employee-based, that's already there. If you have a Medicaid system, that's been expanded and go through. What we're going to talk about as we move through is those individuals that government has already told you have to have that system within Medicaid. That system will change, where those individuals will be able to give a tax credit, go into the marketplace to be able to select through a variety of choices. So they'll be able to pick what healthcare system they want. Kind of like myself and my wife. Our children are older today, so we wouldn't select a healthcare system that has braces because we won't need those anymore for our children. We can pick a system that's much different, one that actually benefits us instead of one controlled by doctors. It'll be a much different system. And because more people are into the marketplace, the price will be lower. Then we look at a high-risk pool. Today, if you look at Wisconsin, in the past, the high-risk pools cost less money than what Obamacare costs today. The premiums have risen too high, the deductibles are too high, Obamacare is collapsing. So we have a system out there that will not work. We have ideas that go forward, we have individuals that are more than welcome to give us their ideas as well as we move through, walking through a new healthcare system.
So you mentioned Medicaid in the middle of that. If you have Medicare, you've got that. You've got employers, you've got that. You mentioned Medicaid as well. The Medicaid expansion was really the way that this district benefited greatly from Obamacare, the Affordable Care Act. Tens of thousands of people got coverage because of that. Is that expansion going anywhere under this plan?
Medicaid will be treated differently. Some states took Medicaid expansion, some states did not. That is something that we'll sit and work through as we talk in committees, and we have a new Health and Human Service Secretary as well. That's why we'll ask others to give us their ideas on how to move through.
When you say treated differently, does that mean that it'll be different state to state? What exactly does that mean? I mean, are the folks that got that new insurance through Medicaid here in Bakersfield?
Well, if you
go ahead.
Well, if you have Medicaid, you don't always get the specialty doctors and the others. Some states took the expansion, some states did not. So as we walk through this, there will still be Medicaid out there. How we go through, those individuals can also have a tax credit to go into the marketplace. As I walked you through that a minute ago, do you understand what a tax credit is?
Yeah.
Okay, so if you're getting a tax credit, it's just like I take this, my tax credit, maybe I have a lower income, that's why I'm on Medicaid, because Medicaid goes up to 138% of income. So I get my tax credit, I go into the marketplace, and instead of only having one choice, I have all these other insurance companies inside the marketplace, and instead of government telling me I have to pick this one healthcare system and they can only offer all of this and all the others are dropping out, I get to pick what I want because I have this tax credit that offsets it and be able to pick inside a variety of choices. Now I'm making the decision, not government. So I've got a better choice, and in there I can pick a system that works different for my family and my children.
So would those that were included in the expansion be taken off of Medicaid and then given a tax credit as a replacement? Is that what you're saying?
I apologize. This hearing piece, I only get a couple words of what you ask.
Welcome to television.
I know, but it's like real loud in my ear.
Okay,
go ahead. Try it again.
Yeah. So those that were included in the expansion of Medicaid, Medi-Cal here, are you saying that those people would be taken off of Medicaid and given in its place a tax credit?
No. No decisions have been made yet. Okay? First of all, no decisions have been made. Hearings are beginning. As the committee goes through, there's a lot of ideas out there. So no decisions have been made. There is one idea to be actually use tax credits. People can use tax credits and move through. What I'm saying is anybody that has ideas can bring them forward and offer ideas. As we go through with this, on the hearings inside Energy and Commerce, I will keep you abreast of that, of the ideas, and keep you abreast of the bills as they move forward on what comes out of committee.
Okay. The folks that have showed up at your office a few times, some of which are from your district, some of which came from outside of your district, have said that they don't feel heard, that the office is closed. Do you think that you can be any more accessible to the people that live in your district?
Oh, I'm very proud of my accessibility. You know that. I mean, you look at all the work that I do from out in the community. I'm home almost every single weekend. The difference here, especially when they bus people in throughout, there's a fundamental difference from coming into the office for constituent casework and then disrupting the office. And if you've been a part of Bakersfield for a long time, you see that. And if you watch when you put all those posters across and you come in and you disrupt the office, what you're doing is you're stopping the ability to help those veterans with their casework or help those people with the IRS casework. And it's really with consultation with the police department and others of why the doors have to be locked when that happens. Because unfortunately, those protests don't clean up that all the signs afterwards. They don't fix my cars when they come to my house and scratch them, or fix the doors when they pound at my house or take over the cul-de-sacs. It's a much different view, and that's used for politics. But I guess that's part of the job. But I still stay from my mobile office days, from my teletown halls, from out and about in the community. I pride myself on the casework that we do. I don't appreciate when you disrupt our ability to do the casework, but I appreciate people's opinion for or against. I always want to hear their opinion, and I always want to be able to have it very accessible where anybody can provide that opinion.
All right. Well, I'm getting the voice in my ear saying it's time to go. So thanks very much for joining us. We very much appreciate it.